Hi, I'm Dom Sisti with the Department of Medical Ethics and Health Policy at the University of Pennsylvania, where I also direct the Scattergood Program for Applied Ethics in Behavioral Healthcare. Today I'm with Dr. Maria Oquendo, the chair of the Psychiatry Department here at Penn, and the immediate past president of the American Psychiatric Association. We're going to discuss the ethics, history, and political implications of the Goldwater Rule. Thank you so much for your time today, Dr. Oquendo.
It's a pleasure to be here. Thank you.
I thought I'd start by asking you to review the Goldwater Rule for our viewers.
So the Goldwater Rule is a ethical code that the American Psychiatric Association has. And the reason it's called the Goldwater Rule is that it arose in the context of the 1964 election of Barry Goldwater, the election process. And there was a magazine called Fact that published a survey of psychiatrists where some of the psychiatrists were stating that Mr. Goldwater was not suitable to be president. And the rule essentially says that it's not ethical for a psychiatrist who has not evaluated a person to opine on their diagnosis. And further, that if they have evaluated that person, that of course the person must give their consent for any diagnosis to be described.
So let's just cut right to the chase. The Goldwater Rule has become a point of controversy over the past, year actually, since the 2016 presidential campaign. You wrote a very compelling op-ed piece in which you basically restated the importance of the Goldwater Rule. Would there ever come a time, do you think, that a psychiatrist's opinion, public opinion, on the behavior of the president would be helpful if, let's say, the president appears to be behaving in an erratic or visibly psychotic or delusional way?
So I think that it's a bit of a straw man argument, because I believe that one can, as a private citizen, observe behavior in an individual and make a decision whether that behavior is presidential. And invoking a psychiatric condition is challenging on many regards. One, you certainly can't be certain that you are correct, because it's very difficult to know what the origins of the behavior are. But importantly, it implies that if you have a mental condition, if you have a psychiatric condition, that you are de facto unfit to serve. And I would argue that that is incorrect.
So the idea is that by using a psychiatric diagnosis, you're actually increasing stigma for individuals with mental illness more broadly. When you say that an individual is unfit for a particular job, in this case president, that has ramifications across the entire population of individuals who are mentally ill.
Exactly, exactly.
If you were to be presented, say, with some objective evidence, let's say speech patterns, is it ethical for a psychiatrist to opine about objective criteria, sort of objective signs and symptoms that are maybe in video or on Twitter or other places?
So I would say that in a situation like that, the key issue is that we might be able to describe what we see. For example, we might be able to describe a disruption in speech patterns, but we really can't tell what it is. So I'll give you an example of something that wouldn't be particularly pathological that could lead to that kind of thing. So let's say, imagine that being the President of the United States is an extremely stressful situation. And imagine that many times you are awake at night thinking about the problems that beset the country. You might not sleep very well. And we know that sleep deprivation does terrible things to cognition, leading up to even hallucinatory behavior.
It seems like so that makes sense. A more holistic understanding of the person is important, and one arguably can only get that understanding through an actual clinical examination or a therapeutic relationship.
Yes.
There's been talk recently about the 25th Amendment, which is the amendment that provides for members of the cabinet, in collaboration perhaps with Congress and others, to declare that the president is unfit to serve, and allows for the removal of the president through a mechanism other than impeachment. And I'm wondering if it would be ethical, or if it's ever been thought about, that psychiatrists, professional psychiatrists, would or should be involved in a process, whether it's this president or another president, wherein they do actually contribute to the discussion around the invocation of the 25th Amendment?
So I think that's a really interesting question, because what I'd say is that, like with other situations where there is a medical problem, you would want to have the appropriate specialist conduct an evaluation.
Right.
Someone who can give an assessment of what the functional capacity of the individual is, what the prognosis is. And in this case also, you would want, if the concern is a psychiatric one, for example, then you would want a psychiatrist to make that kind of assessment. And I think that would be a very appropriate role for the association or for psychiatrists to be executing. And in fact, one question would be, should it be both a psychiatrist and a neurologist if there's concern about behavior, right? Because we know that some of the changes in behaviors that are seen may be due to psychiatric conditions, but neurological and other medical conditions can cause changes in behavior too.
And would the psychiatrist need to actually evaluate the individual, the president, or whoever?
In my opinion, it really would require an examination.
Oh, that's interesting.
And I think a comprehensive history, which would include discussions with people who are close to the individual, including people that work with the individual and family members, would be very important.
Interesting. Okay, so let's back up about a year now to the blog post that you wrote for the APA, in which you defended the Goldwater Rule very, very clearly and unequivocally. And I'm just curious what kind of reaction you got to that post.
So the reaction was mixed. Many people were very sympathetic to it, but there was a vocal minority of individuals who were appalled. One of the objections was that as psychiatrists, we have a duty to warn.
Right.
And in fact, while we do have a duty to warn if we're treating an individual, it has to do with warning a particular person who may be in danger rather than
the entire country.
A population.
Yeah.
Correct. Other types of arguments that have been offered include things like that we are restricting the freedom of speech of psychiatrists. And I would argue that psychiatrists are welcome to opine about whether they think someone is suitable to be president without invoking a psychiatric condition. And as I said a few minutes ago, simply look at the behavior. Does that look presidential to you?
Well, I just want to say thanks again for your time. This has been very enlightening, and I look forward to continued conversation.
Thank you very much for your interest. I really appreciate it.